as possible so that I will answer that. Otherwise, when I start, maternal medical sessions, normally what happens, we don't get to answer the questions. So before you answer the question, let me tell you something in relation to, there are a lot of cases where the patient comes to us and tells us, sir, there is something in the abdomen, there's gurgling sound, and then we have to go for stools. No, this is a very, very common symptom of diarrhea, dysentery, summer diarrhea, winter diarrheas, diarrhea because of eating outside food, spoiled food, uncooked food. So these are very, very common symptoms in relation to the diarrhea. But these symptoms sometimes become very common that, so sir, there's a sound in the abdomen and automatically I start passing stools. So these are the basic symptoms that we come into this. Now I would tell you some cases where I have got very, very good results with some medicines which basically are infrequently used. Infrequent. For example, there's a remedy which is it is written in that there is no gurgling sound in the abdomen and then the patient passes stools. Now this symptom is a very, very common symptom of, you must have seen croton tig, you must have seen sulfur or drugs like that. I'll tell you one very important remedy, that is gambogia. Remember gambogia. Now gambogia, I know it's a common remedy, but sometimes we only give the remedies like arsenic or pulsatilla or naxomic or croton or podophyllum, but we forget gambogia. So lately I had a case where I had also prescribed the patient croton tig. The symptoms were same, that the patient said that there's gurgling sound in the abdomen and then I have to go for stools. So croton tig did not work and then I prescribed the patient gambogia. Now there are some symptoms of gambogia which are very, very important that you should take care of. The first symptom is, in gambogia, the ileocecal region. The ileocecal region is very, very sensitive. Second, gambogia is a remedy for diarrhea, especially in hot weather. You can think about natrum or gelsium or glue, a lot of remedies, but gambogia also is a remedy for watery diarrhea in hot weather, particularly, please write down, second symptom. Third, of course, there is rumbling and rolling in the abdomen. That is also quite normal in gambogia. And one more symptom in gambogia that you should remember in relation to stomach complaint, and that is tenesmus with burning at the anus and forceful ejaculation of bilious stool. Now this is very common symptom of croton tig also, as if stool is passing through a tongue. So this croton tig and gambogia very close, but the basic symptom is profuse watery diarrhea in hot weather, particularly in old people, and sensitive ileocecal region, that is gambogia. So I was just telling some symptoms in relation to gurgling sound in the abdomen and then the stool passes. Croton tig, gambogia, sulfur, natrum sulf, I think thuja is also there. But these 4-5 remedies very, very important. I hope you learned something in relation to gambogia. Welcome Dr. Maurya, Dr. Gopal, Dr. Bharat, Dr. Zeenat, walaikum salam. Thyroidinum 6X is a medicine for hypothyroidism. Yeah, the name sounds very similar, thyroidinum and thyroidinum 6X. I don't know whether you should give thyroidinum 6X as a replacement therapy for hypothyroid cases. He's still here, Maharajji. Or maybe you should give, medicines of thyroid cases. It depends on case to case. In homeopathy, there are a lot of remedies which have been developed. We have remedies like paracetamol, we have remedies like kidney, we have remedies like H. pylori, we have remedies like hemoglobin. Do they really act or not? I cannot say because I don't use these type of practice. Thyroidinum 6S you can try, my dear friend, but I don't know whether it works or whether it cures thyroid cases. I don't know, but I have ample amount of hypothyroid cases treated and cured with homeopathy medicines. Gambogia, sir, your experience about headache of lycopodium. Now see, frankly speaking, whenever you are treating a case of headache, for example, I'll just tell you something in relation to headache. Means either you're treating migraine, either you're treating muscular headache, either you are treating congestive headache. So these are very very common disease that comes to you. But I would suggest only one thing: treat headache as headache and not in relation to diseases. For us, the symptomatic prescription is very, very important. Are you with me? Now, lycopodium. I'll tell you some symptoms of lycopodium which I have used in my practice and then prescribed. First symptom is heaviness. The patient comes and tells you, sir, I have headache, but more important than a headache is the heaviness. The head is very heavy. I cannot move the head. It is so heavy. That's a very important symptom of headache of lycopodium. Okay. In the same way, when the patient is walking or stooping, there is shaking sensation from rising. Patient gets up from the chair and he feels as if something is shaking in the brain. That is a very very important symptom of headache of lycopodium. Third symptom. Now, I would not tell you that temples pain or occipital pain or this pain or that pain, that is, you can read from the books. I'll tell you some important symptoms which I have seen in my practice. There's one symptom of lycopodium headache is that is burning. One patient came to me, sir, I have only, burning pain in my forehead. I said, when does it happen? He said, it's a day and night I have burning, burning and burning. That is also a very important symptom of lycopodium. Are you with me? So this is again an important symptom of lycopodium. Last symptom that you should remember of lycopodium, which I have, of course there are n number of symptoms, but I am telling you my experience. Perspiration on scalp during headache is also an important symptom of headache of lycopodium. Then you can have localization like tension in the vertex, tension in the occipital, burning in the vertex. Those are there, but I would not tell you because I have not seen that and prescribed in practice. So these 4 or 5 symptoms, I can remember only this symptom today. So I'm telling you these symptoms. Okay. I hope it is okay, doctor, who asked me. Dr. Moria. Now, one more question. Bone pains in medicine. Bone pain medicine, remember one thing, Eupotrum perf is known as bone set. You must remember that. We have Guicum, we have Rustox, we have Macphos, we have Symphytum, we have Ruta, a lot of remedies. Okay. Aspidosperma Q-is-it hypotensive and covers digestion. Aspidosperma mother tincture, whatever knowledge I have, is basically a remedy for lungs. If you open Boric Mater Medica, it is written digitalis of lungs. That is Aspidosperma. Okay. Burning. Sir, having difficulty in waking due to extreme dull pain, walking, and neuromuscular weakness. No. If you have a neuromuscular weakness, make sure that you first diagnose what you are suffering from. Neuromuscular weakness is a very very broad term, and to only prescribe on one symptom of walking problem and neuromuscular weakness would be a problem. So to understand what is involved, cerebrum, it is ataxia, it is pyramidal tract problem, it is atrophy, it is lot of things are there. So please ask the questions in detail so that I know what to answer. I don't prescribe on specifics. I have told you before also. Is because of neuropathy. Neuropathy, what? There should be a cause for neuropathy. Diabetes is there or whatever is there. It's a B12 deficiency, and I have answered this question also before. If you don't get any medicine, you can think about vitamin B12 in potency 30-200, depends on case to case. Okay, so I think lycopodium is done, and this abdomen, that is very very important. One more symptom I would tell you, the patient feels as if the abdomen is very hard. He tells, sir, check my abdomen. It is so hard. It is so hard. Now you can also prescribe in these type of symptoms. The abdomen becomes hard or abdomen feels hard. Calcareous carb is there, my dear friend, but you must also think about graphitis and cilicia. Okay, abdomen heavy. Okay, now we have cases where the patient says, sir, पेट बहुत भारी लग रहा है, abdomen is feeling very heavy. Again, think of graphitis also, but the abdomen heavy, you must also think about pulsatilla, nux vomica, allosocratina. I had only one case where I had prescribed, I had given nux vomica, I had given pulsatilla, did not work. In that case, I still remember I had prescribed the patient spigelia, and that treated that case. Okay. Please tell some medicine for pain in neuropathy. Give vitamin B12 in 30 potency or LM potency if you have. Okay. So this is in relation to abdomen. Now you can also have in abdomen. Patient says ऐसे लगता है कि there is fermentation in abdomen. Fermentation in abdomen. Patient says that I feel as if it's a gas, and it's like whenever you're drinking a beverage, a soft drink, and there is a lot of gases, fermentation in abdomen. Then you must think about two remedies, very very important, my dear friend. Both are remedies for stomach, both are remedies for gastric problem, that is China or Lycopodium. China or Lycopodium. Now, sometimes the patient comes and tells you that, sir, if I don't eat, if I'm fasting, I feel very happy. If I'm fasting, I feel very happy. If I eat food, then my complaint starts of the abdomen or of the head or of the knees. This is again a very very important symptom, my dear friends. The patient is better or amelioration by fasting. Of course, we'll consider in relation to stomach symptoms. Then you must think of two remedies, my dear friends, very very important. The first is causticum and the second is silicea. Fasting ameliorates. Are you with me? Fasting ameliorates, very very important symptom. And the reverse also you should know. Fasting ameliorates, and then you must know eating ameliorates. Both things you must know. कि भाई, the patient is not eating, so you can think of causticum and silicea, and the patient says, no sir, when I eat something I feel better. That the reverse condition also you should know. The reverse condition, write down these three remedies which whenever I have used I have never failed. Zincum metallicum, Chelidonium and Lachesis. Zincum metallicum, Chelidonium and Lachesis. Two infrequent use medicines which I have used and had good results. Think about Califos and Bovista. So both the things you have to understand. Eating ameliorates and fasting ameliorates. Okay, are you with me? Did you understand this? Yeah, everyone? Now, okay. So please ask some questions. So if you ask questions, it's very easy for me to answer. Otherwise, in Insta Live also and in YouTube Live also, I'm only speaking for half an hour. Because once you get the rhythm of speaking, I get the rhythm of speaking, then I want to tell you. Now, we have seen eating ameliorates, fasting ameliorates. But the patient comes and tells you, sir, whenever I drink something, it could be drinking water or XYZ, especially drinking water, will stick to that. That also aggravates, sir. So whenever, my dear friends, the patient comes and tells you that drinking water aggravates the complaints, specifically of stomach, first remedy, think about gingiber, my dear friends. Think about gingiber officinalis, ginger. Very very important remedy. Of course, it is very infrequently used, but very important. Also think about. Write down the remedy: phosphorus and arsenic. Also think about phosphorus and arsenic, but first think about gingiber. Now if the patient tell you, sir, I can drink water, there is no problem, but whenever I drink icy cold water, very cold water, I have a problem. I cannot digest. There's gas, there is acidity, there is whatever it is. But icy cold water aggravates. Then your remedy should change. A normal water and icy cold water is different. So whenever icy cold water, don't think about that those remedies which are particularly given in generalities. No, then two remedies again, my dear friends, very very important. First is calcareous phos and second is Restox. Are you with me? Are you with me? Now, so today no question, but your live video are very important to watch, sir. Thanks, sir. Yeah, thank you so much. But I like asking questions, because in everyday cases, maybe 30 years back, we did not have a mentor whom we could ask. And we faced a lot of challenges and a lot of problems in our practice. We learned more from our mistakes rather than from books. So I don't want you to follow that part only, making mistakes and then getting the answers, right? That's why we started YouTube Live, so that you can ask your queries and I can help you or guide you how to approach your case and what remedies to think about. That's why I always ask, please ask questions. So now, before I lose the contact, if the patient comes and tells you, sir, whenever I drink cold water, I feel better. That is also, you must know, eating and drinking. These are the basic enmities of a normal life. So this aggravation, amelioration, you should know. So aggravation by taking icy cold water, we have seen. Now we see the patient is better by taking cold drinks. And the patient says, whenever I am taking cold drink, especially, I had a case where, the child had a problem of abdomen gastritis, gastritis, and the mother used to tell me, sir, whenever he has a problem, he wants cold water, cold water. I know. He just has habit of drinking cold water. That's why he's making a bahana. He's making an excuse to drink cold water. But the poor child used to tell me, you know what? No, sir, whenever I have stomach problem, I am very much better with cold water. But my mother does not give me because she feels that I am doing an excuse. Okay, I also made a mistake. I followed the mother and gave some money. It did not work. Then I told, okay, believe the child. And the remedy which is better by drinking cold is only one, and that is elapse. I just asked one question to the child, that do you like buttermilk? And he said, I like buttermilk. I gave elapse, and elapse 30 cured the case. So sometimes, you also make a mistake. We don't give importance to what the child is telling. But if the child is recurrent telling something, please understand the concept and then give the remedy. Are you with me? So it is abdomen, there were a lot of queries, sir. Tell us something very easy to find the remedy. The most easy is, you cannot miss out what the patient likes to eat, what the patient likes to drink, and what the patient feels in the abdomen, because the patient can remember it very, very easily. So I have taken this for prescription. I hope you understand that. And if you want something more related to abdomen, you can always ask me, because there are so, of course. And then you must always remember one thing. The patient says that, whenever I have an abdominal problem, passing flatus ameliorates, you can take it as a normal symptom. But here this symptom, the patient says, sir, whenever I am passing gas, whenever I am passing flatus, it increases my stomach complaint. And you say, what the hell? The patient is complaining of bloating, lot of gas problem, lot of acidity, lot of burning, lot of XYZ symptoms. And he says, when I am passing flatus, all the complaints aggravate. And you say, my God, is he fooling me? Or is he not telling properly? But my dear friend, there are remedies. When the patient is aggravated by passing flatus, I remember only 2 remedies. I don't know how many remedies there, but 2 remedies I remember. First, Cantharis. You will not believe, Cantharis patient is aggravated by passing flatus. Can you believe it? Cantharis, we have only thought of urine. Of course, very, very important, my dear friends. Second remedy is fluoric acid. So sometimes you enter the case and you find you are confused what the patient is telling, something very unusual, something very unique, something very peculiar. We have remedies for that also. I can remember today only 2 remedies, but you can go home and read Matermedic, you can get more remedies also. But these remedies I have tried and tested in my practice. That's why I'm telling you, I am a clinician. So don't ask me what is written in books. This is written in my clinical practice. Are you with me? And you, everyone? Yeah, lot of people asking me questions about related to heart problems. Sir, you have a good practice of cardiology, and you have treated cases of coronary artery blocks and valve problem and LVF less. I always tell you, I can tell when there is a soft heart or soft pulse and all, it would be very good lecture. But normally you will not get those type of cases in your practice very frequently. So you will like the lecture, but clinically you will not be able to appreciate that, because the number of cases coming to you will be, you take time to get these type of cases. So there were a lot of questions on my WhatsApp and Facebook. So I'll tell something about heart. So I always refrain from telling, because first you have to understand what is the meaning of regular pulse or high bonding pulse or low LVF or heart muscles and all. It's a bit difficult. So if there are a lot of questions, I will definitely ask, but then forget that, because those type of cases will not be flooded in your OPD. Abdomen cases which the patient remembers is very, very important. Are you with me? Yes, everyone? I had one more interesting case. The patient says, the patient had a pain in the abdomen, and the patient says, whenever I place my hand on the abdomen, I get a lot of pain in the abdomen. There is a lot of gases problem and acidity. A patient telling you that placing the hands on the abdomen aggravates the complaint. My dear friend, I have used only two remedies in my practice: Sorinum, Zincum metallicum. So if the patient says my lot of gas problem, the gas is very bad smelling, it is like dead mice, and placing the hands on abdomen aggravates, give the patient Sorinum, it will work. I have a question. Your experience about mother tincture and uses? Yeah. So Dr. Moria, very good questions. In my early days of practice, when I started my practice, of course 30 years before, the what we were taught and what we had seen and what our knowledge of homeopathy and allied sciences was not so, I'm telling my experience, not so much. So if I knew a case maybe is of urinary stone and I know the patient is phosphorus, but I have to add Berberis vulgaris mother tincture also, because I was thinking, okay, phosphorus would work and Berberis also is a good remedy for stones, so I used to give. Patient of blood pressure used to come to me, and I knew the remedy was Aurum metallicum, but I said, okay, give the patient Rolfia also, because it will support my medicine. In the same way, patient used to come for cough complaints, so I used to give my remedy and mother tincture of Justicia sometimes. The patient of pimples used to come to me, and I knew the remedy was maybe causticum, but I used to give mother tincture Berberis Equifolium also, so it supports the medicine. I used to do that, I'm telling you plainly also. But then gradually, when we learned from our mistakes in my practice, I started tapering the use of mother tincture, and I now rarely use mother tincture in the practice. So this is my experience. We used to use mother tinctures also, simple mother tinctures, like we were taught that Craticus is a heart tonic, so we used to give Craticus. Then Dolphia, Berberis vulgaris, Berberis Equifolium. I can remember these only. Justicia. So I used to use in my early days of practice, but then gradually I started tapering it off, and I now hardly use it. I hope this this answer is sufficient, Dr. Moria. Okay. Yes or no, you can always answer me, so that I know that you're understanding what I want to tell you. So in relation to abdomen, I think these questions are, yeah, Dr. Moria, thank you so much. So this question, like eating aggravates, eating ameliorates, drinking ameliorates, cold water, hardness of abdomen, passing flatus aggravates. These are very, very common symptom the patient will come to you. Do they come in your practice with this type of symptoms? You can write yes or no, so that I get a boost that, okay, you are understanding what I want to tell you. One more common symptom the patient comes to with the abdomen is that the patient holds the abdomen. He will come to you, either he will do like this, doing the pant up, or holding the abdomen and coming in your chamber. This also the patient can do. And the patient says, I feel better when I hold my abdomen. Again, a very, very unique and a very, very peculiar symptom of holding the abdomen better. So Previously, I never used to give importance to that, so that I used to feel, okay, I've got the case, I've got the mind symptoms. But every time, the mind symptoms you are interpreting, if it's right, it's very nice. If it is wrong, then you make a mistake of prescription. But the patient is coming and telling me, when I hold my abdomen, I feel much better, sir. He's telling you in front of you. So when the prescription used to fail, as I told you, we learn from our mistakes more than from the books. So patient has to hold the abdomen. The patient holds the abdomen. My dear friends, very, very important remedy. You can never think of that remedy. Agnus Castus have given me very good results. Patient holds the abdomen. Sepia, very, very good results. And third, if I remember that remedy, Staphysaceae. I think we can check out that. So Agnus Castus, Lilium tig, and Staphysaceae. The patient holds the abdomen. Are you with me, everyone? Yeah. So the patient holds the abdomen. If you are done with that, now one symptom, the patient will come and tell you, because milk is the basic, need and the basic food of life, we say. This you should remember. The patient will come and tell you, sir, okay, sir, patient keeps referring to an old health complaints even after recovery again and again. How to interpret this rubric? Okay, so very, very nice. Go to generalities. I think that rubric is given below symmetrical complaints. We have 3 or 4 rubrics, if I can remember the repetitory page. I don't know the page number. Symptoms ameliorates and aggravates without any cause. Symptoms keep changing. Symptoms, group of symptoms reoccur. A group of symptoms going here and there, wandering. So in this, old symptoms reappearing, that is also a rubric in the repertory, my dear friend. It is placed below a rubric in generality, symmetrical complaints. Below symmetrical complaints, there is one more rubric, and below that is symptoms. And we have 4 to 5 sub rubrics. Go and study that rubric. You will get the answer from that. Okay. This is the knowledge of repertory which I have, and I feel the knowledge is okay, because if I can remember the rubric where it is given, I have to just go and find out. Okay. You'll be surprised that there's a rubric, symptoms go here and there, wandering symptoms, and pulsatile is not there. Very surprising. Okay. So I hope you got the answer, Dr. Maurya, Dr. Ayush. Okay. So I hope you got the answer with that. So abdomen, I was just telling you something in relation to milk. The patient comes and tells you, especially a child will, the mother will also say, ye dudh nahi pita. It does not drink milk. And the patient comes and tells you that drinking milk ameliorates the complaint. Drinking milk ameliorates the complaint. My dear friend, think about Veratramal, Nux vomica, and Ruta graveolens. Nux vomica, Veratramal, and Ruta graveolens. But the patient comes and tells you that my child only likes hot milk. Bolenga, mujhe hot Bonvita. I like hot Bonvita. I like hot Complan. Everything hot. But my mother does not give me. She says, you have a stomach problem, drink normal milk. But I want hot milk. Listen to the poor child, because he is suffering from complaint. So at least ask him also. Don't always ask him. Mother will always telling something more for the child. He will be telling, it is my child. I know what he suffers from. The child says, Mummy, I like hot milk. Give me hot. I am better with hot milk. My diarrhea is better with hot milk. There's a rubric. Better with hot milk or hot milk ameliorates. The only remedy in that rubric is Croton tig, my dear friend. Croton tig. Are you with me, everyone? So homework for you would be, go home and search the rubric in generality, symptoms. You will be surprised to see many of remedies which you have never thought of also. Okay, so it is already half an hour up, and thank you for joining me, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Thursday for Instagram Live. Bye.